The center has dropped medicines such as ivermectin, doxycycline, and hydroxychloroquine from its guidelines to treat mild COVID-19 cases. The revised guidelines issued by the Union Health Ministry's Directorate General of Health Services on May 27th recommended that only use of antipyretics for fever and antitussives for cold medication in mild cases can treat COVID-19. The Health Ministry, in updated detailed clinical management protocol for adult cases of COVID-19 released as on 24th of May, had suggested that doctors ask mild COVID-19 patients to take ivermectin once a day for 3 to 5 days or hydroxychloroquine twice for 1 day and once for the next 4 days. Now the updated treatment guidelines state that apart from fever and cold medication, no other COVID-specific medication is required in case of mild case. The guidelines recommended that patients observed COVID-appropriate behavior like wearing masks, washing hands and maintaining distance from others. They added that patients should teleconsult with their doctors, monitor temperature and oxygen saturation levels, and eat a healthy and balanced diet. For asymptomatic cases, the updated guidelines recommend not taking any medication. It asked only to continue medications for other comorbid conditions. In case of moderate and severe infection, the guidelines provided detailed protocol for hospital care. They recommended that a computed tomography or CT scan should be done only in case the symptoms worsen. In its revised document, the center also included guidelines for the use of remdesivir. It is to be used only in select moderate or severe hospitalized COVID-19 patients on supplemental oxygen within 10 days of onset of disease, stated the guidelines. Here question arises on how deadly is COVID-19 in reality. Are the common people of the country deceived? Time is to question oneself. How are the medical experts now suggesting that by intaking paracetamol used for common cough and cold, Ayurvedic or homeopathic medicine, COVID-19 can be treated sitting at homes? Why then to treat COVID-19 all through this year? Hydroxychloroquine, ivermectin, zinc, multivitamins have been prescribed by the doctors, and now all these medicines have been dropped to treat the disease. And now people have been asked to take paracetamol after such a long time. Question remains, if such a huge number of deaths all over the country has been reported due to wrong medication, perhaps the motive was to turn the COVID-19 into a deadly pandemic so that the present flourished business of vaccines could be achieved. We, the common people, are helpless at this point of time, have turned into dolls against the central powers. We should take time to think twice. If the drugs were mistakes, it did more harm than good. What about the vaccine? Bureau Report, Hallabol.